I'm Jason Slagle. Our session was on patient care and workflow considerations. There were many great points and issues identified during our presentation. We're just trying to summarize and capture just a few of them really in such a small amount of time. So one of the first points that was brought up during our session was that the investment in data engineering is very important in order to get scalability and to provide automation and standards. Another key point was just identifying many key issues that really need to be addressed in order to implement the integrated diagnostics, such as trust, understanding, accountability, timing, options, prioritization, annotation, and actionability. And really, Dr. Chowdhury's one of his key points was the way that ID or integrated diagnostics will be perceived and used so that clinicians want to use it and aren't concerned about trust issues and them being held liable for using such diagnostics. Another key point or main focus point was about EHR and hopefully in the future electronic health systems integration and the need to consider many elements such as data visualization, machine learning for workflow and diagnostics, and multi-level modeling. One of the challenges and issues also is that a major bottleneck is involved in the limited talent and the challenging recruitment issues involved in getting data scientists, the most talented ones, to work on these challenges that we face in regards to integrated diagnostics. And then it's really important that we follow the risk communication principles. There were many mentioned by Dr. Politi, including using numbers instead of words and really presenting the data in a very simple and visual format and as far as the numbers to keep things consistent and in terms of denominators and using absolute and not relative risks. There were many other points made, but in the interest of time, we'll go ahead and stop there.
We can go to the next slide. So I'm Naik at the University of Texas Health Science Center in Houston. So I'm going to cover some of the policy opportunities that came up in our presentation. The first opportunity is after initial validation of an algorithm, ongoing implementation and testing requires a focus on the principles of high reliability organizations. And this is really a focus around reliability of the implementation in a consistent way, and an effort to reduce unwanted variation in the process. The second opportunity for sustainability and scalability need to consider open source protocols for algorithms. And then in addition to having the algorithms themselves be open source, encourage, promote interinstitutional sharing and testing of those algorithms and protocols. These are critical steps. Opportunity 3 is for integrated diagnostics. We need a code of conduct for the criteria that govern implementation. So really a code of conduct around AI and how it's implemented into practice. And Dr. Dorr talked about that a bit. Opportunity number 4 is a redesigning of the electronic health records, health systems, especially the user interface that allow for better integration of diagnosis and treatment into a holistic modules that guide decisions rather than forcing clinicians to hunt for different diagnostic components across the EHR. I actually think, as we've been talking about this and others have raised, this effort will be facilitated if we actually reimburse at the level of diagnosis rather than the procedures that you're hunting around on the EHR to find. Opportunity 5 is the use of decision aids and communication tools, especially those that follow validated principles to improve, oh, got something. We lost the, okay. Use validated decision aids and communication tools to improve the patient-clinician decision-making process and where it happens at the clinical interface around integrated diagnostics. And finally, opportunity 6 is to use innovative clinical trial designs, such as hybrid implementation effectiveness designs, to help facilitate the simultaneous testing of the novel integrative diagnostic methods and tools, as well as the processes and implementation strategies in which the context in which they're being tested. So these hybrid designs can allow you to test these two things separately or to test them as they're embedded together and evaluate them in a clinical trial format. Thank you.